Hi, I'm Ketan from Brightside Dental. Welcome to episode 32 of BSTV. Today I'm going to talk about cracked teeth. Now, many of us naturally have small cracks within our teeth. Most of the time our patients often don't know about them unless they can visibly see them. And for many people they don't cause any kind of problems. However, for lots of our patients, and it is something we see on quite a regular basis, they can get pain or symptoms due to cracked teeth. Now, the main types of things that can cause cracks in the teeth, one would be from biting into something very hard, something like nuts, ice. It could be bones within meat that then cause a crack to happen within a tooth. Another thing can be due to trauma, so it could be an accident, a fall, getting knocked in the face from playing sports or from a fight, something like that. And then other main aspects can be due to excessive trauma from the teeth, not from an accident, but from repeated tooth-to-tooth pressure, which is what we call bruxism, or heavy forces. That can also cause damage as well. And another one that I often see with patients that do sometimes own up to doing things that they shouldn't be doing, like opening bottles with their teeth or opening clothing tags rather than using scissors. These kind of things can also cause cracks as well, and we would think of it as silly things, but at the time, convenience wise, you have your teeth, you might not have a pair of scissors or a bottle opener, so please don't do these things. Now, when we do see patients who have problems from cracked teeth, the symptoms can vary quite a lot, and sometimes it could just be slight pain on biting, or it might even be when relieving the pressure of biting. We get a little bit of pain that lasts a few seconds and then it tends to go away quite quickly. It can also be pain that just seems to come about by itself, but again, generally it wouldn't last very long. Another one can be when eating or drinking. So the common things that can cause discomfort are either hot or cold food or drinks, and it can also be sweet things as well. Another thing that would definitely be a sign of cracked tooth is if you actually noticed that a part of your tooth is broken and moving with pressure. Now, there's various different treatments for cracked teeth, and part of that depends on what the cause of the problem is that we find, and how much it bothers our patients as well. So treatments have quite a vast range. So it starts from no treatment at all, which sometimes is appropriate, and we would monitor the situation and the symptoms if they're quite mild and keep them under review at regular checkups. The first type of active treatment is what's called composite bonding, where part or all of the crack may be removed, or if there's a loose part to the tooth, that would either be removed or rebonded back with composite filling material in order to deal with the problem and seal the crack, and often that's a very simple and effective treatment. Another thing would be if there is an existing filling in a tooth, it might be to remove the filling, so that then it's possible to remove part or all of the crack, or sometimes it might not even be possible to see the crack, so then it would be to investigate further, and then either a new filling would be placed, or sometimes it might be initially a temporary filling, and then to review the situation. Another treatment is root canal treatment. Now, that would be undertaken if the crack has progressed very deeply into the tooth and has reached the nerve of the tooth, or it's caused infection of the nerve, then root canal treatment often would be appropriate. Another treatment would be to place a crown or cap to cover the tooth. Now, in doing that, the aim is to protect the tooth better, and also it can help close the crack and balance the forces in the mouth when biting. Now, this is sometimes done as a standalone treatment, or it may be carried out following root canal treatment on a tooth. And then the final option, which is extreme, is extraction of the tooth. Now, this is sometimes necessary when a crack is too far gone to be able to restore and rebuild a tooth, or sometimes in appropriate situations, a patient may opt for that kind of treatment. Now, as I said, it is a very large range, and what we would always do as a practice is, where possible, we try and do the simplest, most straightforward, least invasive solution first, and then keep the situation under review, and if it is appropriate, then we move on to another solution. I've personally got a crack in one of my teeth that I've had for quite a number of years, and I'm fortunate that up to now I've not had to have any treatment for it. So it's kept under review, and I do find from time to time that I might get a few days where it will be aggravated, cause some discomfort, and then fortunately it settles down again. So if you do have any concerns, discomfort in this way that I've mentioned, and would like some further advice or have it looked at, then by all means do let us know. Thanks very much for joining me today, and join me next time for more tips and advice on improving and maintaining your oral health, along with practice news. Have a great week.